Welcome to Prime at 9. I'm Lishini Chaste. Now, as doctors continue to protest across, it seems like there is no end to patients' woes in the hospitals across India. Vandana, a patient's mother who came to RML hospital, said her son has a kidney-related disease and doctors had asked to undergo some medical tests. Today, her son was supposed to undergo an eye test and accordingly, an appointment was fixed, she said. But due to the protest, no testing is taking place in the hospital and her son was referred to this hospital from GTP hospital, said Vandana. Another patient from Dwarka said his wife has to undergo surgery on January 11. Before the surgery, a biopsy procedure needs to be completed, he said. Now the doctors are protesting the biopsy has been delayed for the time being and he doesn't know when they will conduct a biopsy, he said. Now let's get across our senior reporter Anguli in the newsroom to get more details on this big story. Yes, L. Yes, L, it's been like around 12 days that the doctors are protesting. What is the latest update on this big story and then has there been a breakthrough yet?
Yeah, I think going by the reports that we have been having every day for the past about 12 days, so far there has been no indication that there is a solution in sight. Of course, the government has tried to meet with the resident doctors, and yesterday the Union Health Minister met with the resident doctors. And it was not a discussion, it was merely an interaction between a minister and a group of resident doctors. And during the meeting on Tuesday, the minister expressed regret for the action that was taken against the resident doctors during their protest. They allegedly assaulted some of the protesters, for which the protesters again intensified their agitation. And they were also told by the minister that right now the matter is pending in court, the Neet-Pg counseling process. The matter is in the court, so this is something we cannot do anything about it right now unless we wait for the court to say something. So those were the only assurances that were given to the doctors. There was no invitation for talks about hammering out a solution to this issue.
Okay, so what is the response of the protesters in this regard?
It's the same stand that they have been having over the past about 12 days. In response to the Union Health Minister, the resident doctors said, we are not satisfied. So they practically told him that they're going to continue with the agitations, but this time the agitations will be continued not based on the issue of Neet-Pg counseling that they have been so far demanding to be resumed. This time they are going to resume and continue the agitations in regard to the action that was taken against them by the police. They're alleging that the Delhi police manhandled them and assaulted them. So what the resident doctors are demanding is that they want a written apology from the Delhi police. The Union Health Minister had actually expressed regret, but even that too, they are not satisfied. They want a statement from the Delhi police, and they want today on Wednesday the government that they're not going to call off the protest unless the Delhi government issues a statement of apology.
Yes, L. We have also heard of many cases of patients being denied treatment because of this protest. So to what extent these protests has been affecting the hospital services?
Yeah, Lishani, just as we were reporting a little bit earlier how some of the patients have been suffering because there were no doctors available in the hospitals. Right now, it's only been about 2 weeks now since the protests began, and it would help to have some data, some stats to tell us that this many patients are suffering, this many ventilators are not working, this many hospitals are not working, this many registration counters are not working, there's no one there, this many personnel are missing from work because of the protests. I wish we would have some kind of a data like that to actually measure the impact of the protest on patients. But what I can tell you right now is that most of the government hospitals in Delhi are facing shortage of specialized level health workers, and that is the doctors, the resident doctors. They are an integral part of the health infrastructure, and they offer specialized service support to the hospital management. So there is shortage of resident doctors. So in such an event, it is the outpatient patients who are suffering. For example, in Delhi right now, there is no registration going on for patients who want to be admitted in the hospital. No registration. Even if you are dying, if you don't register, they are not going to take you in. That is the process there. And patients in need of urgent medical attention, hypertension, diabetics. So those people, they cannot go in and get their regular treatment the way they used to, because the doctors are all on the streets protesting.
Now that we are hearing about the health services facing difficulties, what else do we have to worry about besides this?
Yeah, Lishani, that is a question I think the government has been asking over the past about 2 weeks since the protests began. Right now, there is shortage of resident doctors, specialized healthcare workers in the hospital, and the protests come amid a pandemic. And right now we are talking about the increasing number of the new COVID variant Omicron. In Delhi on Wednesday, 73 fresh cases of the variant was reported, taking the capital's tally to about 238 Omicron cases. Now that's a huge jump from about 3 weeks ago, where it was only about 26 even in Maharashtra. So what we're talking about here is not just the health patients, outpatients who are suffering for lack of attention from specialized healthcare workers such as doctors. What we're talking about here is a very weakened, very thinned healthcare service providers who will be taking charge of a very significant and scary case as the pandemic, that is the COVID pandemic. So the health infrastructure is not ready to really tackle COVID cases in case the third wave comes. So that's one thing that is bothering the government right now.
Thank you, Al, for the latest update.
Thank you, Lishani.